Hello, this is Dr. Do again. This video is still on alphabetic list problems. I think I finished the letter N and any important either diseases or concepts or presentations or symptoms. I think I finished it. So I'm going to move on to the letter O. The first thing came to my mind is ocular diseases because it is quite common, could be minor or could be serious. And also it's important because we all know eyes are the window of our heart or our soul. It's just saying that we have to, the eyesight, to keep the clear eyesight is very important. So start from ocular diseases. Let me just, I think I have some previous videos talk about individual diseases like cataract or glaucoma or retinal diseases. But this video or probably following videos, I've just put everything together. Put the eye as a whole unit. We'll try to introduce some diseases and for different structures. And first of all, let me just bring up the emergency situation. Any ocular diseases that warrant emergent visit. I think I mentioned it before. First of all, if it's a loss of vision, depends on the age actually. Usually for the young children, the most common eye diseases is trauma. So that's the emergency situation. Regardless of the chemical or mechanical or any kind of injury related to the eyes, go to the emergency room or talk to your ophthalmologist or your family physician. And I think probably the sooner the better, because you do not know the depth of the injury. And for middle-aged, again, injury and also some other symptoms, impaired vision. I think one of the young adult or middle-aged people, I can think of the emergency situations, the infection, so particularly associated with the contact lenses. If the discharge is greenish and feel severe pain, don't hesitate. The sooner the better. And also for those who had systemic diseases, of course, hypertension, diabetes, suddenly develop this loss of vision or vision not clear, seeing halos or seeing floaters. We all have this kind of seeing floaters, but for those the systemic disease and suddenly vision get not clear and associated may or may not have eye pain. So this is another sign to see your physician as soon as possible. And the other one is, I can think it's the glaucoma, acute angle-closed glaucoma. I think I talked it before, you probably knew it. It's just suddenly, usually it's unilateral, just one eye, suddenly develop this cruciating pain, and seeing may get red or swelling and tearing and photophobia, cannot see clearly. And so these are the, particularly for this closed angle closed glaucoma, I think Asian, small eyes. I'm going to explain that. I think I mentioned it before. And also, if you have lost the vision field, it's, even though maybe not urgent, but it's definitely the sooner the better. Talk to your physician. If you only see half or tunnel or whatever, you cannot see. If you square around you, then probably you need to see your physician to talk to your ophthalmologist or emergency room or family physician, whoever you're comfortable, and then start from there. So this is about the emergency situation associated with ocular disease. It's quite straightforward. Trauma, regardless of age, trauma, of course, it's always, and also the systemic disease associated with the loss of vision, impaired vision acuity, or glaucoma, like acute angle-closed glaucoma, or the infection associated with greenish discharge, contact lenses you wear Usually you take it off every day, but suddenly you're just too tired, forgot to take it off, and then the next day the eye become red, discharge, and very painful. Go to the emergency room or see your ophthalmologist or see your family physician as soon as possible. So these are the basically I can think about the emergency situation. If I miss that, I'm going to break down individual structures and then mention it. Is there any eye condition you can manage at home? Probably you already did. For example, the occasionally you feel itchy and or foreign body, you get them out. So that's probably, but usually I think even though you have allergies, conjunctivitis caused by allergy, or even though you know it is pink eyes, there's no, doesn't have to be managed by the prescribed medication, but still need to see your doctor to get diagnosed, to exclude serious problem, then you can manage at home. So this is about the in general the serious condition warrant an emergent visit, or some minor condition you may use over-the-counter eye drops. So on top of that, let me just talk more about the eye. The first thing I can think about is the eyelid. It's very important. There's some muscles and to help us to open and close eyes surrounding, or just a piece of muscle. And there's some glands, either just mimic our sebaceous gland in the skin. Those glands can be undergoing blocked, like a chalazion, for example, a little bump there. It doesn't affect you if it's not infected. You just cosmetically doesn't look good, or becomes style, which get inflamed with the inside tissue get necrotic and become supportive. So that's the style. If that's the case, you need to see a doctor, either a specialist or your family doctor, and then addressed by them or referral. So usually if you have that, you can try it with some warm compress, see whether you can solve. If you have chalazion, for example, try it. But usually it's not going to be easily solved, so you have to see a physician to get removed, to drain those material outside from those style or from that chalazion. And also the eyelid associated with the inflammation caused the gland will be inflamed, not just one or two glands blocked cause the chalazion, but it's the inflammation. Usually those occur in the male, because they're just like the sebaceous gland in the skin tend to contain more lipid, so it's a good media for bacteria. Regardless if you see the scaly from the eyelash and also feel itchy, see your doctor. I think probably it's better to exclude some parasites or some serious infection, and then treat accordingly. So this is about just the introductory of the ocular diseases. I'm going to continue next time. Thank you for watching, and I hope it helps. I'll see you next time.